Pneumonia is the world's biggest killer of children. In 2011, about 3,500 children died every day because their caregivers didn't know how to prevent it or because they couldn't get the treatment to cure it. The poorest families bear the heaviest burden.
Poor children, those who are malnourished, are more likely to get it, and because their immune system is not so well developed, or they're not as likely to get to treatment, they're also more likely to die. So the highest rates of death from pneumonia, as well as the highest incidence of pneumonia, are in the poorest countries and the poorest parts of countries around the world.
Yet pneumonia is easily and cheaply treated. A dose of amoxicillin, the antibiotic commonly used to treat it, costs 30 cents. It's estimated that more than 1.5 million lives could be saved in 5 years if the drug was more widely distributed. Pneumonia is also quite easily prevented. Breastfeeding is an effective practice. Hand washing with soap reduces its incidence by 23%.
These kinds of very cost-effective and cheap interventions would dramatically reduce it. And we've calculated that we could get all countries down to a level of 20 deaths per thousand, which in effect is all preventable deaths have been avoided. So within a lifetime, we could have a world in which the chances of a child surviving are the same in Niger or Ethiopia as they are in New York.
This year, world leaders committed to the Promise Renewed movement, which aims to eliminate preventable childhood illnesses. Encouraging governments and communities to prioritise the prevention and treatment of pneumonia is a key part of that goal. This is Chris Niles reporting for UNICEF Television.